Everyone's Dr. Paul. So here we're going to be going over advanced lower limb perturbation training. So if you or your doctor is noticing that you have a tendency to shift your weight in an abnormal fashion, let's say shift your weight too much onto your toes, then there's a way that we can use this setup to actually have you reflexively correct that and shift your weight back more towards the midfoot. So let's say that I do have a bit of a forward weight shift in a squat where I'm shifting too far forward, knees are coming forward, heels are almost coming off the ground. In that case, I can do a setup on this board right here to correct that. So what I'm going to do is actually facing this way, be putting my foot in front of the center of this platform, causing me to shift my weight back. So to do that, I would first place my foot in a mirror position on the stable platform. Then I'm going to step center and forward onto the unstable platform. So this is causing me to have to shift my weight back a lot more actively. So it causes me to, one, do the weight shift, but also activate muscles that encourage that weight shift as well throughout the entire limb and core. So from here, I can practice the movement that I'm trying to improve. Let's say I'm trying to improve an air squat. So I'll do about 10 reps there, and then I'll come off and I'll retest my squat and see, has my anterior weight shift reduced now? So now, for example, if I'm squatting, am I getting more of a weight shift through the center of my foot near the shoelace? And this is just one example for how you can use it. So in terms of what's going on, your doctor will be prescribing certain directions, but they can vary drastically from person to person. So there's no one size fits all here, folks. So for example, your foot can be forward of center, back of center, outside, inside, and all of these directions are in the vector of too much sway, too much compensation. So for example, let's say that as I was squatting, a lot of times my knee caves in on this left side. So to correct that, I could place my foot center with the unstable object on the stable surface first, but then I'm going to step and actually step inward a little bit. So notice how if I just let gravity take its course, my entire knee is going to cave in. So I have to react and shift and actively hold away from that course. And that primes all the muscles that help to reduce that fault right here. So again, there are a whole variety of ways that we can use this to essentially reprogram how you move at a high level in the brain itself, so that way there's less conscious thought that needs to be applied.